Welcome. So this is going to be a short discussion of how to write P2 and D1, which focuses on the skills and attributes of care providers. So this is all part of Unit 5, Meeting Individual Care and Support Needs, or the coursework unit for BTEC Level 3. So the learning criteria, the key things here, this is part of the learning criteria sheet. And the area we're focusing on here, as I say, is P2 and D1. So these kind of overlap. So for P2, we're looking at explaining the skills and the attributes necessary for professionals who provide care for individuals with different needs. And then to evaluate it, because the D1 runs throughout the whole of Section A, we're going to evaluate the success of these practices. And it's more focusing on how easy it is to perform them, the difficulties, the challenges, and how effective they may be. In a follow-up video, I'll talk about M2 and D1 and how to write that section separately. So what are the 5 areas that we were talking about as these skills and attributes? So the first is the 6 C's. The 6 C's are made up of care, compassion, competence, communication, courage, and commitment. Now these were introduced as part of the compassion in practice guidance and strategies for nurses and midwives, I think in 2012. And what you need to think about when you're discussing these skills is how would the professionals involved in your case studies use them? So what skills would they have to show? Now this would apply to all case study characters. You would hope that all the care professionals would show care and compassion, be competent in their role, but ultimately explain the 6 C's. What do they mean? How does it apply to a theory? How would it be used in your case studies contexts? Now people skills is slightly different. Again, this is about your relationship, your ability to interact with people. So people skills like empathy, patience, engendering trust, flexibility, a sense of humor, negotiation, honesty, problem solving. These are all skills you would need to just be able to interact with someone on a one-to-one basis. So again, when you're looking at your case study characters, think about your professionals who work with them and what skills would be essential in them showing or using to work with your patient to help your case study character feel at ease and also the benefits of them. Now for communication, there's quite a lot of communication here, but ultimately it's thinking about how would you talk to someone, how do you communicate with someone. So it might be thinking about stuff like active listening, responding, tone of voice, communication skills. And really when you're thinking about this, think about what could also be barriers to communication, what could be challenges. So a number of the case study characters use an advocate. How would they fit in with the mix? How does an advocate change the communication process? Observation is really, there are 2 types of observation skills. So it's the ones that are measurable, like volume of blood, urine, pulse rate, blood pressure, and ones that you can see, such as whether a patient is POW, flushed. Now in our case, what we'd be thinking about is what could you observe with your case study characters? What observable features in their situation could you look at? Obviously a lot of our professionals, they may not be looking at pulse or blood or some of the workers, but it'd be what could they see? What are the symptoms or visual symptoms of some of their conditions? And what can be difficult in doing these observations? And then last but not least, we've got dealing with difficult situations. So this is kind of how would you break bad news to someone? What would you need to do to have a sort of a difficult conversation with your characters? What would be the source of a difficult conversation? And would there be any barriers that you'd have to overcome in order to communicate with those individuals? So just to kind of fit this into the context course. So I would start off by explaining, defining and outlining each skill and attribute area, and use the textbook, use your knowledge, use your online research. I would say maybe start with the 6 C's and if we'll go through that, explain what they are, how they work, how professionals could use them, how it would be used with your case study characters, and that's the most important bit, linking it to the professional and how they would interact with your case study. You can consider also the dangers if you didn't use these. What would it do? By using these, what are you avoiding? So you can kind of look at it in that way as well. Then move on to people skills and do the same thing. What are they? How do professionals use them? What would be achieved in terms of benefits for individuals? What's being avoided? Come back to then move on to communication. A little bit of overlap with the 6 C's, but again, you're going into more detail here about communication skills. Same with observation. How are they important? How would the professionals use them? What can be observed with your characters? And then how would you deal with that difficult situation? What's the best way to talk to your character about something that's quite difficult or challenging? And then once you've done those and you've explained those skills, move on to evaluation. The easiest way to evaluate, I think, is what are the challenges of using them? What is the benefit that comes from it, using these skills, particularly with your case study characters? Why is it difficult to apply them, and what would be the benefit of using them properly? And then just as an overview of what applies, so I think the 6 C's, the people skills, the dealing with difficult situations, apply to all the characters regardless. They all have those 6 C skills to include. I think when you're breaking difficult situations, there are extra things to consider. So I know, say with Nusrat, with Alice, I think with Brenda, potentially with Maria, there are other individuals involved. So breaking bad news to them has to be done through an interpreter or an advocate. That's the same as you see above with communication. When you're communicating with them, there are extra people involved in all those discussions, advocates and translators. That can make some of these difficult situations slightly challenging to break. In terms of communication with Martin, you can see he has reading difficulties, so written communication is difficult for Martin. In terms of what you could observe with each character, so with Patrick, you could maybe think about the symptoms of HIV. With Nusrat, it's signs of epilepsy. With Alice, it's the alcohol consumption, liver disease symptoms. With Brenda, maybe it's to do with her asthma, stress. With Martin, it's stress and skin conditions. You can maybe even stretch in that you could be depressed by a situation, so you can maybe keep an eye out for depression. With Maria, you might be looking for signs of stress, that she's not coping. With Maria's mum, you might be looking for signs of possible neglect, that her mum isn't being cared for. People skills, I think, apply to all the case study characters. Same with the 6 C's. Outline what they are, apply them, and think about which ones would be the most useful for them.
I'll just drop them.
Okay, and last but not least, just as an overview of what we are doing here. So as I say, first provide a general information that you've covered in the section. So what are the 6 C's, people skills? Outline what they are. Apply to your case studies as an extension of first point. Maybe think about the effect on pies and how it would affect your individual. When you're linking it, again, be specific to your individual context. Try and avoid being generic or general. Try and think about their specific needs and the specific skills that you would need because of their needs. Throughout this, focus on the professional. What is the professional doing? How can the professional use those skills? Try and be detailed and write as much as you can. Try and avoid copying large chunks from the internet. That's not going to get any marks. When you do use stuff from the internet, quote it, reference it, and also apply it. So when you put a web link in, first of all, say what the web link is, what it shows, how it's relevant to your discussion, and then link it to your character. Why have you put that reference in? What has it got to do with what you're looking at? And try and use subheadings, headings, or make it clear when you're writing what is the past element, what's the content, and where the evaluation comes in. So you can do this any way you want, as long as these features are here and your teachers or the moderator, the examiner, can see them. That's what we're looking for. Okay, hopefully this has helped in helping you to understand how to write P2 and D1, and good luck.